Thank you very much, Mr. Chairman. I am really grateful that this committee is having the opportunity to focus on the impact the opioid epidemic is having on individuals, families, communities, and what we can do to help them. I'm also really grateful to all of our witnesses today for bravely sharing their stories and lending your expertise. It's vitally important. As we have seen again and again, this epidemic doesn't just impact one person. It has a ripple effect that impacts entire families and entire communities. If we are going to beat this public health crisis, we need to make sure we are providing resources to everyone who's touched by it. We need to make sure we are healing all the damage it does, and we need to be listening to the full stories, all of them. The stories told by hospital staff, like those I recently visited in Longview, Washington, who told me that half of the babies they delivered were born to mothers battling opioid addiction. The stories told by the sharp increase nationally in babies born with neonatal abstinence syndrome who were born seizing and shivering and struggling with other symptoms of withdrawal. We need to be listening to the stories of the 90,000 children removed from homes deemed unsafe due to a parent's challenges with drug use, and the stories of the children struggling with the impacts of trauma in schools, which lack the resources they need to meet their unique needs. But the story isn't just told by children, it's told by parents. Parents who've watched as the children they would do anything for struggle with a disease they feel helpless to do anything against. Parents who don't know where to turn for help, even if they can afford it. Who feel disheartened by a child's relapse, who feel silenced by the stigma. And the story is told by grandparents and relatives who must step up as guardians and caregivers. When we fight this disease, we need to fight it on all of those fronts and for all of those people. We have to do more than stem the tide of the opioid epidemic. We must also acknowledge and address the damage it does. My constituent Elise's story shows why this is so important. When she became pregnant with her daughter, she was struggling with addiction. She was in and out of jail during her pregnancy, and by the time her daughter was born, 2 months early, and with a small amount of meth in her system, Elise was facing a 7-year prison sentence. Her daughter was immediately placed in foster care, but that's not the end of Elise's story. She received treatment in prison. She fought against her addiction, and she fought for her family, her daughter, and their future. And she won that fight. She beat her addiction and regained custody of her daughter, and she decided to help others going through the same thing. Today, she works with Parents for Parents. It's a program that pairs parent mentors with families battling to stay safely together. It takes a holistic and evidence-based approach to the challenge of healing families. Results have shown that the program makes it more likely that families stay together and less likely mothers and fathers lose their parental rights. There are many approaches, like Parents for Parents, that serve these broader needs and deserve our full support. Congress has to continue its bipartisan work to combat this crisis by addressing both the root causes and the ripple effects of the opioid epidemic. That means we have to address childhood trauma. We have to train teachers to understand how it can affect children and how to avoid knee-jerk discipline that does more harm than good. We have to make sure young people understand the grave risks of misusing opioids, and they are equipped to avoid making decisions that could take their lives in just one night. We have to support parents who need information amid the uncertainty of how to help a struggling family member, support amid the fear of stigma in discussing the disease, and reassurance amid the common trials of relapse. We need to address the needs of pregnant women, postpartum women, and their infants with substance use treatment that allows them to safely stay together. We must reorient our child welfare system towards prevention services for families. Programs like Head Start offer a 2-generation approach so children and families get the support they need to heal, grow, and succeed together. Research has shown that children brought to the attention of Child Protective Services who are enrolled in Head Start programs are 94% less likely to be in foster care a year later. We need to confront the challenges of everyone this crisis affects, and we need to do it in partnership with everyone who can help affect change. That means working closely with stakeholders, ranging from federal, state, and local governments, to healthcare providers, to educators, to public safety officials, and most importantly, families. Unfortunately, while President Trump has declared the opioid crisis a public health emergency, his promise to address it rings hollow today in light of the actions. At a time of public health emergency, President Trump's administration has been sabotaging our health care, making it harder for people to get Medicaid, which helps provide substance use disorder treatment, proposing dramatic cuts to drug control offices and programs that are designed to promote evidence-based treatments, and leaving key leadership positions empty. The President may not be taking meaningful action, but I have been really heartened to see Congress continuing to work in a bipartisan way to solve this issue, like when we passed the 21st Century Cures Act to fund state efforts in prevention and treatment and recovery, and when we passed the Comprehensive Addiction and Recovery Act, which supports specific outreach for veterans and pregnant and postpartum women. It expands access to medication-assisted treatments and more. And I am very encouraged that the recent bipartisan funding deal includes additional resources as well. Of course, even as we act, we have to continue to listen to those stories like Elise's, which is why I'm incredibly grateful to hear from all of our witnesses today, and why I'm already planning to meet with more parents like Elise and more children like her daughter when I get back to Washington State later this month. And finally, before we begin, I do want to submit a statement for the record from the American College of Obstetricians and Gynecologists on this topic as well. Thank you.
Thank you.